They were grossing $120,000 a month.
10:30 no later than drop them drawers. I know what you want. I ask myself, is this shit real? I contemplate about how I feel.
Hey guys, it's the Bougie Nurse and welcome back to my channel. For those who don't know me, my name is Casey. I am a registered nurse, and on this channel we talk about all things nursing. And in this video, I'm going to be talking about the top 10 highest paying nursing specialties of 2023, with number 10 being the lowest paying and number 1 being the highest paying. So let's get right into it. Number 10, we have the family nurse practitioner. So this is an advanced practice registered nurse who provides healthcare services for patients of all ages. So your infants, your adolescents, your adults, and your seniors. In some states, the family NP can even operate their own practice and prescribe controlled substances, giving them a whole lot of autonomy. Their average salary comes in at $112,000. Coming in at number 9 is the clinical nurse specialist. And what the clinical nurse specialist does, they provide and coordinate patient care activities. They can also participate in medical research to improve healthcare practices. And the thing with the clinical nurse specialist, they can work pretty much anywhere. They can work at a prison, they can work at a nursing home, they can work in private practice, they can work at the hospital, and their average salary comes in at about $114,000. Number 8, we have the certified nurse midwife, and what they do is they specialize in women's reproductive health and childbirth. So they'll be following women's health from adolescence years into menopausal years. And for pregnant women, they provide prenatal care visits, they provide care during childbirth and after the baby is born. So the certified nurse midwife is similar to an OBGYN. The only difference is they provide more natural techniques, and the average salary for a certified nurse midwife is $117,000. Number 7, the general nurse practitioner. So the general NP provides direct patient care, performs examination, and prescribes medication, all while maintaining an emphasis on disease prevention and health management. They pretty much function exactly the same as a primary care physician. They don't require the direct supervision of a doctor, and typically they have their own practice or clinic where patients can go to them and seek consultation. And they come in at an average salary of $120,000. Number 6 is the orthopedic nurse practitioner. This nurse practitioner is going to take care of patients who have musculoskeletal injuries or disease processes, and they're going to be working alongside the physician to help these patients recover from surgery, rehabilitate from injury, and return to full mobility. The orthopedic nurse practitioner salary average is the same as the general nurse practitioner average, both ranging at $120,000. Number 5 is the oncology nurse practitioner. This nurse practitioner's work consists of the management and treatment of patients with cancer. So they're going to be working alongside these patients, providing their cancer treatment and medication. They're going to be providing comprehensive care. They will have to educate them about the prevention of all different types of cancer. So their workload is going to consist of a lot of research due to the fact that there are so many different cancers out there, and they're gonna have a lot of difficult face-to-face interactions with these patients. Their average salary comes in at about $122,000. Number 4 is neonatal nurse practitioner, and this nurse practitioner provides care for high-risk infants due to prematurity or low birth weights, infection, heart abnormalities, even the newborns who have long-term health complications up until the age of 2. You're typically going to find the neonatal nurse practitioner in the emergency room or the NICU because they are dealing with high-risk newborns. The job outlook for the neonatal NP is really high because people will always have babies, and their average salary comes in at $132,000. Number 3 is the highest paying of the nurse practitioner group, and this comes in as the psychiatric mental health nurse practitioner. So this NP works to provide care for patients who are suffering with mental health issues, behavioral challenges, and psychiatric disorders. They can assess, diagnose, and treat mental health patients through therapy, prescribing medications, providing counseling, and they can do it in a variety of settings. They can work at a correctional facility, in a prison, they can work in a clinical setting, they can work in a group home, they can even work from home through virtual counseling. And the psychiatric mental health nurse practitioner's average salary comes in at $140,000. Number 2 is not going to be number 2 for long. The only reason it's coming at number 2 now is because we are still in the pandemic, and while rates are decreasing, you know where I'm going with this, while rates are going down, there is still an opportunity to make a lot of money within this specialty: travel nursing. Travel nurses have been known to gross 6 figures within 3 months. Now, that is not the case as of now, but the average travel nurse contract right now is at about $3,000 a week. And there are high-paying travel nursing specialties that are still paying $6,000 and $7,000 a week. I've even seen a contract for a labor and delivery travel nurse coming in at $8,000 a week. Because of supply and demand and short staffing, the average salary for a travel nurse is ranging between $145,000 and $200,000. Travel nursing is not going to be these numbers for much long, but because of the pandemic and staffing issues, travel nursing is still really good right now. Coming in at number 1, okay, this is the creme de la creme of nursing. This is the highest paid nursing profession. They are on top of the food chain. Is the CRNA, the Certified Registered Nurse Anesthetist. And they are responsible for providing anesthesia to patients during surgery. It is a high pressure job because they're responsible for putting people to sleep, monitoring them while they sleep, and making sure they wake up. So it's not a job to take lightly. And they can be called into last minute emergency cases that they weren't prepared for. Sometimes they can be on call, you can be at home enjoying time with your family, and then you get called into the hospital. So they are compensated well for their job duties, and the average salary for a CRNA is $150,000 to $250,000. At the very beginning of the pandemic, when it was really bad, CRNAs, travel CRNAs, were making $30,000 a week. Yep, you heard that correct. Now, I don't think the numbers are still that high because things have been dwindling down, but pre-pandemic, post-pandemic, CRNAs is gonna always be at the top of the food chain. They're always gonna be the highest paying of the nursing specialties. The salaries that I mentioned in this video will vary significantly based on the state you live in. So some states may be higher or lower than the average that was mentioned, but these are going to be the top 10 highest paying specialties of 2023. And this pretty much concludes the video. Thank you all so much for watching. I hope to see you guys in the next one. Bye.
10:30, motivated, then drop them drawers. I know what you want. I ask myself, is this shit real?